Most common questions which we are asked is what are the top 5 or 7 symptoms of obstructive sleep apnea? A. Tiredness, fatigue, snoring, choking, gasping for air, high blood pressure, obesity. What is the connection between obstructive sleep apnea and heart? We have established that in great detail. It can lead to anything wrong with the vascular system, including stroke, heart attack, cardiac dysrhythmias. Can obstructive sleep apnea be managed naturally? Absolutely. If you lose weight, you could lower or eliminate completely obstructive sleep apnea. Living with obstructive sleep apnea is cumbersome because biggest challenge which I find in my practice is some people cannot bear the idea of having something on their mouth. They try everything under the sun and they cannot tolerate it. If you are one of those very rare 3 to 5% of the patients, there is a surgical procedure now. What we do here in that procedure is we on the right side, we like a pacemaker, we put a generator and it sends a wire back to your throat muscle near the tongue comes in, and then it has a dial. We could program it that if you go to bed at 11 o'clock, 10 o'clock, then that generator kicks in and that keep your muscle, send this muscle stimulus to the muscle while you're sleeping, so the muscles are taut, the airway does not close. That we all seen a lot of ads in the on the TV regarding Inspired system. That's exactly what it is. It is not as simple as the ad kind of tells that they are throwing the CPAP machines and they are free and all those things. The technique is getting better, but it's still a surgical procedure. It has the wire has to go in the back of your throat, and also the battery life is about 5 to 10 years. It needs to be replaced and over. Currently, as we are talking today, that procedure is reserved for only severe, or very severe, or morbidly obese people who have very difficulty in accepting CPAP or be able to use it properly. So to give them a backup system because it can lead to sudden death. Next question was, what is the science behind CPAP and how it works? With CPAP, we are providing a constant pressure which is over and above the closing force between the tongue and the posterior of your part of the your pharynx, which keeps delivers the enough pressure with the air. It keeps them open so that you relieve all the symptoms of sleep apnea. In my experience, this is a wonder piece of equipment. It has changed many people's life and prevent countless heart attacks, strokes, and death. Sleep studies, what to expect? Not much. Even the study comes in for a layperson to understand and do that part. I don't think they need to exert your physician is competent. They should be able to take care of interpreting and making you understand your symptoms. And that is one of my wish is to help you to understand sleep apnea so that you could make right choices and help yourself and prevent all the complication. Next question is, what is the right CPAP for me? We have not used in last 4 to 5 years other than auto CPAP because we don't want to go back to over and over this issue that you have to adjust your pressure. The machine is smart enough to understand how much pressure it has to deliver, and it is very, very safe, and that's what we will do. Diet. Any diet which will lead to weight loss has to be a balanced diet, which is predominantly plants, legumes, whole grain, healthy fats, will lead to prevention and treatment of obstructive sleep apnea. Can surgery cure obstructive sleep apnea? If we are talking about throat surgery, we call it uvuloplasty. It is a surgery where they go back and they remove part of the soft palate so that there is nothing for it to block. Yes, that will cure it, but if you continue to gain weight, your soft tissue can grow back. But technically, that should cure your sleep apnea. But I think CPAP, especially auto CPAP, is the best. If the Inspire system, where they put a generator and the wire like a pacemaker, technology improves, the local skills of the surgeons who are performing these procedures become good, that definitely has a hope. But problem is, if we cure one problem and we don't go back to root cause of these problems, we will continue to have issues. The common problem, common link between all chronic medical problem is obesity, lack of exercise, undue stress, no pause or time in life to relax and think back, and taking sleep for granted. If we add all these things to our life, we solve a lot of chronic medical problems. You will find that once you become healthy, everything gets better. Your blood pressure is better, sugar is better, cholesterol is better, sleep apnea is better. There is no back pain, no muscle pain, no ankle pain, no knee pain. Everything gets better and everything falls, start getting worse together. I hope I have convinced you that sleep apnea A is important to screen. Common symptoms are tiredness, fatigue, snoring, gasping, quitting breathing at night, and being tired, affecting both emotionally, cognitively, and psychologically. We should not ignore it because it has healthcare consequences and it affects predominantly all important organ system in the body. Treatment is very simple. Studies at home studies are very, very easy to get it done, and the treatment is very predictable. Thank you very much for giving attention. Please like, share, and subscribe to our channel, Kundlas MD. Please do comment on our content because that gives us insight into what we should do more, how we could improve. Like always, I'm humbled and thank you very much. I will see you next week in new podcast on a different topic. Thank you.